Hello, my name is Joseph Greenwell. My pronouns are he, him, and his, and I serve as the Vice President for Student Affairs in the Office of University Life. I'd like to start by just thanking everyone for being here for this important conversation as we reflect on where we've been, where we are, and the future with the global pandemic of COVID-19. For those of you who may not be familiar with University Life or new to Columbia, University Life serves as a student hub within Columbia University. We partner with all of the schools and departments across the institution to provide resources, enhance the student experience, and build community through programming, initiatives, and information sharing. Our core values are centered on equity, inclusion, and belonging, sexual respect, and well-being. University Life's forums are focused on important and timely conversations. Our goal is to share critical, need-to-know information and to provide space for questions, for your questions. Throughout COVID-19, we have worked hard to ensure that these panels bring you actionable, up-to-date, evidence-based information with a larger aim of keeping each of you, and in return, our larger community safe and well. I'm incredibly heartened by the commitment I have seen in our students to the measures we need to take to keep the larger Columbia community and our neighbors safe. Gateway testing, face coverings, physical distancing, these are all practices none of us could have imagined just a year ago. And I want to acknowledge that this effort is not easy to sustain after so many, many months. But it is just imperative today, as it is ever, that we stay committed to each other and to keeping each other healthy. Day in and day out, we see our commitment and our concern for our greater good and our community. And I see that in all of your actions, and I thank you. In just a moment, I'll introduce today's panelists, and we'll jump right into the conversation. We'll focus on your questions in the second half of the conversation. I have to say, we are so fortunate to have some of the most accomplished and knowledgeable experts at Columbia and with us here today in the fields of medicine, public health, and psychology and mental health. I'd like to start by introducing Dr. Wafaa El-Sadr. She is the professor of epidemiology and medicine at Columbia University and director of the Global Health Initiative at the Mailman School of Public Health. Dr. Wafaa El-Sadr, MD, MPH, and MPA, is a university professor of epidemiology and medicine at Columbia University, the director of ICAP at Columbia University, and director of the Global Health Initiative at the Mailman School of Public Health. She was also newly appointed to serve as the director of Columbia's World Projects. Congratulations, Wafaa. Founded by Dr. El-Sadr, ICAP is a global leader in HIV and other global health threats. ICAP focuses on strengthening health systems that provide technical assistance, implementation support, and research in partnership with governmental and non-governmental organizations in more than 21 countries. In this role, she leads the design, implementation, scale-up, and evaluation of large-scale HIV, tuberculosis or TB, and maternal child health programs in sub-Saharan Africa and Asia that provide access to HIV services to more than 2.2 million people and collect data for more than 5,200 health facilities. Dr. El-Sadr is a prominent researcher and has led numerous epidemiological, clinical, behavioral, and implementation science research studies that have furthered the understanding of the prevention and management of HIV, TB, and non-communicable diseases. She is a principal investigator in the NIH-funded HIV Prevention Trials Network, or HPTN, which seeks to prevent HIV transmission globally. Thank you, Wafaa, for being here. I'd like to also introduce Dr. Melanie Bernitz, Senior Vice President for Columbia Health and Medical Director of Columbia Health. Dr. Melanie Bernitz joined Columbia Health in 2016 as Associate Vice President and Medical Director, and just this week was promoted to Senior Vice President. Congratulations, Melanie. Previously, she served as the Executive Director of the Student Health Service at Columbia Health Medical Center. Prior to that position, Dr. Bernitz was a chief resident, and faculty member in Columbia Center for Family and Community Medicine. Growing up in the United Kingdom, she received both her bachelor's degree in psychology and a degree in medicine at University College London. She then received her master's degree in public health at Columbia University. Dr. Bernitz's professional experience includes the teaching and training of medical students and residents, as well as inpatient and outpatient care. She is an associate professor of clinical medicine in the Center of Family and Community Medicine and is committed to ensuring that college students have direct access to high quality, timely medical care. Thank you for being here, Melanie. Last but not least, Dr. Aisha Holder, counseling psychologist at Columbia Health. Dr. Holder joined Columbia Health in 2015 as a postdoctoral psychology fellow and became a staff psychologist in 2016. Prior to joining counseling and psychological services, she completed her internships at Princeton House Behavioral Health, as well as clinical psychology externships at Rockland Psychiatric Center, Center for Study of Anorexia and Bulimia, and Iona College Counseling Center. Prior to pursuing a career in counseling, Aisha was vice president at JP Morgan Chase in the Organizational Development and Corporate Training Group. Thank you so much for being here, Aisha. So without further ado, I'd like to open the conversation by calling on Dr. El-Sadr to share her points of view with the public health and health systems lens. Wafaa, if you will, please.
Thank you very much, and very much appreciate this opportunity today to speak with all of you. So I'm going to get started and provide really a COVID-19 pandemic update. So for starters, I think all of us are aware that the COVID-19 pandemic continues to grow with increasing numbers of cases reported on a daily basis. As of January 27th, we have reached over 100 million confirmed COVID-19 cases globally and more than 2.1 million reported deaths already globally as well. Importantly, I think it's to note is that the largest numbers of reported cases of COVID-19 have come from the Americas, from both North and South America, followed by Europe, Southeast Asia, Eastern Mediterranean, Africa, and Western Pacific. And the top 5 reporting countries continue to be the US, has consistently reported the largest numbers of cases, followed by India, Brazil, Russia, and the United Kingdom. Now, what about the COVID-19 situation in New York City? Again, the pandemic continues to grow and deeply affect New York City, with now more than 580,000 reported cases of COVID-19 and more than 26,000 reported deaths. And what we can see here that over the past several months, since the beginning of November or so, we've been experiencing in New York City the second surge in terms of numbers of cases. Now, on a daily basis, about 5,000 or so cases of COVID-19 are reported on a daily basis in New York City. We are hopeful that we're beginning to see some plateauing in the numbers of cases, but still very large numbers reported every day. And then the positivity rate in terms of amongst people who are tested for COVID-19 is now at up to almost 9%. The impact of COVID-19 on the city itself and its 5 boroughs varies substantially, as you can see from the map here in the right upper hand corner. With the darkest brown are communities most severely affected, and then the lighter orange are less severely affected communities. But nonetheless, you can see that there's great variability, but also at the same time, there's huge impact on New York City overall. What's really important to always remind ourselves of is that the COVID-19 has really affected our population globally as well as locally and demonstrated great disparities in health and health outcomes. You can see here from this figure on this slide that in terms of the case rates, this is per 100,000 population, that again, higher numbers of cases amongst Blacks or African Americans, as well as Hispanics and Latinos when compared to white population. And even more dramatic when we look at hospitalization rates, again, you can see the rates here amongst Blacks, African Americans, and Hispanics versus white population. And similarly with death rates, with substantially higher rates of death, again, in these two populations versus amongst the majority population. What about SARS-CoV-2? What have we learned about transmission and control? As you are all well aware, we know that COVID-19 is a respiratory, that SARS-CoV-2, which is the virus that causes COVID-19, is a respiratory virus. It's largely transmitted by individuals who have the infection to others who do not have the infection through what we call droplets that are coughed, they're coughed out of the mouth or nose, and also through smaller particles, which we call aerosols. And it's hypothesized that potentially also the virus can be transmitted by fomites, meaning surfaces, meaning if somebody coughs on a surface, for example, and then someone else comes and touches that surface and touches their face or nose, that potentially they could transmit it this way. Although the vast majority of transmissions are due to droplets and aerosol. So in terms of how do we control pandemics and where are we at now? So it's really important, of course, to always anticipate epidemics before they happen, and then to have early detection, be vigilant and detect early transmission. So when you have localized transmission, so you can mobilize really rapidly to contain the transmission, and to try to do that before you reach this stage of amplification where there's enormous transmission in the community, when it becomes very hard to use some of the traditional methods for controlling outbreaks and epidemics. And then ultimately, with putting in place control and mitigation measures, we can then reduce transmission again and be able to suppress transmission with the goal that hopefully we can eliminate or eradicate this new pathogen, this new virus. Now, what are the measures that we have at our fingertips? We have, of course, population interventions. And these include limitations on mobility of population, stay-at-home directives, restrictions on travel, closure of schools, limited congregation of people. We also have as well individual interventions like the physical distancing, at least 6 feet apart, face coverings and masking, hand washing, cough and sneezing etiquette, disinfection of services, staying home if one is sick, and of course, very importantly, isolation, rapid isolation of COVID-19 cases and quarantine of contacts. And Melanie will really cover this area in much more detail. Now, in addition, we also have biomedical interventions. These include testing, and that also will be covered by Melanie as well as the potential of vaccines, antiviral drugs, as well as what we call neutralizing antibodies. And thus far, we've had, until very recently, what I'm calling the non-pharmaceutical vaccine, which are these population interventions and individual interventions. And we've known that these interventions actually work, and they work very well if they're adhered to consistently. Now, we're very fortunate to have also at this point some COVID-19 vaccines. So ultimately, what we want to do and need to continue to do is to continue with the non-pharmaceutical interventions and supplement those with the vaccines. Now, the effect of these population measures and individual measures have been shown in many different parts of the world. And this is just a slide to show you what happened in China with very large numbers of transmissions. And by taking into account some of these measures in terms of strong interventions to prevent migration and lockdown and really quarantining, as well as, of course, masking, this resulted in a rapid decrease in terms of numbers of cases. So let's move on now with vaccines and vaccine development. We're very fortunate that now we actually have several vaccines that have been approved and authorized for use in the United States. There are more vaccines that have been authorized elsewhere around the world, and I'll tell you more about them. But also the good news is that there's several other vaccine candidates that are now in different phases of development, going through the research, the early phase research, second phase research, third phase research, until we can get to studies that can demonstrate that the vaccine is safe and effective, and then that positions it to be approved for use in populations. Now, one of the most common questions we get asked is how were these vaccines developed so quickly, the 2 and more vaccines that we have at our fingertips now? I think it's important to actually, I always feel like we should flip the question and ask, why should vaccines take so long usually to be developed? We know that can be done much more quickly. Now, for the COVID vaccines in particular, the vaccine developers had a head start because their work that was done already in research labs, working with the prior SARS vaccine, SARS virus, as well as with another coronavirus, the Middle East respiratory virus. And this foundation enabled then building on this and developing the COVID-19 vaccines rapidly. Importantly is that there were no shortcuts that were taken in the research process. So all of these vaccines that have been approved thus far did go through these various phases of development. And importantly, the findings from these studies were evaluated by independent bodies that did not include anyone from representatives of the government or representatives of the pharmaceutical companies that actually created those vaccines. Another important fact is that what was done with the COVID-19 vaccines is that manufacturing of these vaccines was done simultaneously as these studies were ongoing. So that also enabled the arriving at these vaccines very rapidly. I think also the enormous interest by people in general in COVID-19 vaccines motivated rapid enrollment in these studies, so we're able to get to the findings of these studies in a very timely manner. And then lastly, there's an existing process at the Food and Drug Administration that allowed for rapid authorization for use of these vaccines. Now, what are the status of the vaccines? There are lots of leading vaccines that have been identified, and some of them have already been approved in different countries. And the two that are available now in this country, in the United States, are the Pfizer-BioNTech vaccine and the Moderna vaccines. And both of these use a technology called mRNA vaccines technology. But there's several other vaccines that are being studied in the United States and around the world, and we anticipate that over the next several weeks and several months, that hopefully we will have other vaccines available to add to the supply of vaccines for the United States, but also importantly for the rest of the world as well. Now, what about these two studies, the Pfizer and the Moderna vaccine studies? Who participated in these studies? That's a question we get asked all the time. So about 50% of the participants were women, about 80% or so were white, about 9% were African American or Black, and about 28% were Latinx, and about 4% were Asian. In terms of the age, what's important is to note that about 42% of the participants were older ages, which is of course the age where people are most vulnerable to complications of COVID-19. And importantly is these studies enrolled substantial proportion of individuals with what we call comorbidities. That means other illnesses that have been, like for example, high blood pressure, diabetes, obesity, and so on, that also lead to complications with COVID-19. How well do these vaccines work? They work stupendously well. Pfizer-BioNTech, 95% effective, and the Moderna, 94.1% effective. So these are amazingly effective, efficacious vaccines, which is great news. And also importantly, no serious side effects have been noted. Most of the side effects have been mild to moderate. And both of these vaccines require 2 doses. That's important to keep in mind. For the Pfizer-BioNTech vaccine on day 1 and day 21, for the Moderna on day 1, and the second dose should be given around day 28. Now, people are asking, is it necessary to get the 2 doses of the vaccine? It is absolutely important that people get the 2 doses for the following reason. Is the antibody levels, these are the response to the vaccines that are developed after 1 dose, are not really sufficient. And people need to get that second dose so they can boost the response from the first dose of the vaccine. And also important to keep in mind that the studies that were done, vast majority of people who participate in the studies got the 2 doses of these vaccines. So the data we have on the efficacy of the vaccine is based on people getting 2 doses. Now, what are the most common side effects? I'm using here the example of Pfizer-BioNTech. As I mentioned, most common, they're mild to moderate. Most of the side effects have been local, meaning at the injection site itself, a little bit of pain or redness or swelling. It seems that younger people are more likely to have these kinds of reactions because their immune system is stronger. And there's some systemic types of side effects that have been reported, like, for example, headaches and fatigue, but also important to note that these all have been mild to moderate. And also that some people have had a more robust or severe reaction or prominent reaction at the local injection site in particular, and maybe some of the systemic sites after a second dose of the vaccine. There are ways in which we keep an eye on the vaccine safety. There's a system, an app by the CDC called vSafe that all vaccine recipients should download and report if they experience any side effect. And there's also is a passive surveillance system where anyone can report side effects from the vaccine. One of the most common questions we get asked is, what about severe allergic reactions? And the good news is that these are unusual, and it's been reported that they occur at about 11 cases per million doses of the vaccine. And most of these severe cases have occurred within 30 minutes of receipt of the injection. And that's the reason why we recommend for people who've had prior severe allergic reactions that they get observed for about 30 minutes, and everyone else needs to be observed for only 15 minutes after receiving the injection. Now, what about vaccine allocation and distribution? Who should be prioritized for vaccination? An easy way to remember is two categories. One are people who are at higher risk for infection in COVID-19, like healthcare workers, essential workers who mix with the public, people of certain race, ethnic groups, as well as people who reside in congregate settings like long-term care facilities or homeless shelters or prisons. The other category are people who are at higher risk of getting complications of COVID-19, getting severe COVID-19. And this includes people of older age and those with these comorbid conditions that I mentioned, as well as pregnant persons as well. So that's the reason why we prioritize vaccination. It's based on these two categories. Now, in New York City, currently, those who are eligible for vaccination include healthcare workers and residents and staff in long-term care facilities, as well as older individuals 65 years or older and first responders, as well as faculty and staff at schools and in-person instructors in colleges, and also as well some of the other essential workers, as I mentioned before. What about vaccine intentions and acceptability? In order for us to achieve the impact of vaccination, meaning have the desired effect of vaccination, we need to get, of course, we need to have two prerequisites. One is we need to have vaccines that have high efficacy, like the vaccines I mentioned to you just now, and we also need to achieve high uptake and high coverage of these vaccines. If we're able to achieve high coverage and we have really good vaccines, we then have an opportunity and a chance to actually achieve the desired impact of these vaccines and control of the pandemic. But we know that there's a continuum of vaccine acceptance. There are people at this end of the spectrum who are convinced and they really are quite willing and eager to get vaccinated. They have strong demand, they're ready to act. On the other end of the spectrum, there are people who are doubtful, who don't either they strongly don't believe that they need the vaccine or don't want the vaccine. And then there are people in the middle that have more of a wait and see attitude in the middle here. Our goal is to provide the information, the accurate information and motivation so that people on this on this trajectory here, on this broad spectrum of acceptance, is that they're moved to hopefully be willing to get vaccinated. And there's good news, as you can see here, comparing data from the US, from a survey in the US in December 2020 versus in January 2021. We're doing better in terms of about 47% now of individuals who were surveyed indicated they had already been vaccinated or that they get it as soon as they can. But again, we're concerned because there's substantial proportion that still have this wait and see attitude, and only some indicate they'll only get it if they're required. And also there are some that indicate the full 13% they definitely don't want to get vaccinated. I don't have time to go through this, but there are various strategies that have been proposed to get people to act, get people to be comfortable with vaccines. And these include, of course, trying to make it easy for people who are ready and willing to get vaccinated, for those who are probably say yes, to try to answer their questions and to move them to getting vaccinated. For people who say probably no, we need to work with them and their communities to get trusted advocates, from champions from these communities, as well as medical advocates, as well as to craft the right messaging as well, to enable them to feel comfortable and to feel that their questions have been answered and that they're willing to get vaccinated. For the people who say definitely no, we need to be very careful about not demonizing them, but rather to continue to provide the answers to their questions and create narratives that would help them to get to want to be willing to get vaccinated. What about the way forward? I think the situation in the United States now is quite alarming. And this is a map of the US, and it shows the risk of getting COVID. And you can see here in the darkest magenta color are areas of the US where the risk is extremely high. And even in most of the United States, it's not extremely high, but it's also very high or high. So the situation now is that we need to be very vigilant. We need to continue what we talked about, the non-pharmaceutical interventions, while we're awaiting eligibility and expansion of vaccine eligibility and vaccine uptake. And what are in situations in which the risk is very high? Indoor activities are extremely dangerous right now in these areas of the country that are in the magenta color, and that includes New York State and New York City, to avoid non-essential travel and avoid events with more than a handful of people. And this is very important because what we've noted is that people sometimes, when there were small groups of friends or family members, they let down their guard, and that's where we're seeing transmission. So the drivers of SARS-CoV-2 transmission now are really these small household or indoors or in the dorm get-togethers where people feel safe, but they don't distance or they don't wear masks, and that's where transmission is happening, as well as, of course, continued transmissions in prisons and other congregate settings. So another area, another aspect that I want to highlight is what we've noted as well is over time, what's concerning is that the adherence to these NPIs, non-pharmaceutical interventions, is actually decreasing over time. And that's of great concern because these are interventions that we know work and that we need to adhere to now more than ever. Now, I'll touch very briefly why it's really important to adhere to this now more than ever is because of the new threats of these new coronavirus variants that you, I'm sure, have heard about, some variants from the UK, from South Africa, from Brazil. And there's evidence that some of these variants are more transmissible, which means that we have to be extra cautious so that we actually adhere to these interventions that I just mentioned so we can prevent transmission of the virus from one person to the next. So finally, I think that very importantly, when people ask me what should I do the day after I get vaccinated versus the day before I get vaccinated, I say nothing changes for the foreseeable future. This is because protection from vaccines is not immediate. No vaccine is 100% effective. We don't know how long protection is for, and we have limited information as to whether the vaccine actually prevents infection. We know that it prevents COVID disease, symptomatic disease. So for the foreseeable future, we need to adhere to all those good measures that Joseph mentioned at the beginning and that I mentioned in my talk, in the earlier part of my talk. And thank you very much for your attention. I'll stop here.
Great. Thank you so much, Wafaa, and really giving us that broad global context and the impact of COVID-19 at this moment in time. And now I'd like to turn to Dr. Bernitz to talk more locally about what's happening at Columbia and how we're supporting our student community and the entire community on this matter.
Great. Thank you, Joseph, and thank you, Wafaa. Always hard to follow such an incredible presentation, but good afternoon, everyone. Thank you so much for joining us today. And as Joseph said, I'm Melanie Bernitz with Columbia Health. And I oversee the student health service here on the Morningside campus. And this past year, along with Wafaa and many others, have been working with the University Advisory Task Force on COVID-19 as we've really worked through the institutional response to this pandemic. Wafaa really framed beautifully the global and the national and even the local situation. So I just wanted to share some data from our campus picture and bring this down a little more to what's happening right here on campus, as I know many of you may be returning. Our campus picture is a little better than the New York City situation that you've heard described. Since June of last year, we've done over 125,000 tests on our campus with a cumulative positivity rate of 0.41%. And over the last 3 weeks, we did over 10,000 tests per week. We have seen a slightly higher positivity rate, but this is to be expected for gateway testing as we're having affiliates return after travel or family visits over the holidays. And actually, it's the exact reason why we have a gateway program that I'll describe a little later, so we can detect these positives before they access campus. We're continuing to do a lot of work around testing and then tracking our positive cases, those through our program and those outside of the university. And we know our rapid response around contact tracing is really working to prevent further transmission. Our contact tracing team has a very active caseload, both of cases and those who are close contacts, and this is happening across all of our campuses. So daily routines, how our lives have really changed. Our community has become really familiar with all the requirements for returning to campus. For those of you who've been here, it may be a new year, but it's the same Columbia Compact. And for those of you who are new to campus, it's really quite simple. We know, and Wafaa highlighted some of this, that these everyday routines keep us all safe. Keep a distance, wear a mask, stay home if you're sick. And these are set forth in the Enhanced Health and Safety Policy that you'll all read and the Columbia Community Health Compact. We're recognizing our shared responsibility for community health. This is informed by science and is founded on mutual respect for each other. And each of us knows that we in Columbia are operating differently than we did before the pandemic, and that these changes require us to take on new habits and difficult adjustments. But we also know that these changes, both what we do on and off campus, are actually essential to our ability to be together and to stay together on campus. So remember these, as I say, are really important. For those of us who've been coming to campus again, completing our daily attestation in the Reopen CU app has become very routine. To me, I always say I brush my teeth and I do my app. However, over the months, we've actually adjusted this app as we've learned from our experience, and the system, we hope, is more intuitive. It allows people to answer questions honestly, which is what we want. We don't want you to have to think how to answer the question to get a green pass. We want you to answer honestly so that those who should be on campus are allowed on campus, and those who should stay home get the red pass and don't come to campus. And there are 4 simple questions that you have to check every day. They ask about a positive test, recent travel, close contact, or symptoms. If none of those apply, you'll get a green pass. But if some of them do apply, check the box, and then you'll see some drop-down options. Again, allowing you to really answer honestly. And in some cases, even if you check the top box, depending on what your answers are to the drop-down boxes, you may still get a green pass and be allowed access to campus. Below the submit button, there's also 4 check boxes for the required elements to be on campus. And that's signing the compact that we spoke about, completion of the training, which is the enhanced health and safety training, completing your gateway test that I will speak about shortly, and for students, a required flu vaccination. And if any one of these now is not completed, you generate an automatic red pass, which inactivates your swipe access to campus. And you need to complete that element in order to restore your campus access. So throughout the day, once you're on campus, make sure you're following all of this guidance, because again, it's keeping us all safe. Having spent a whole semester doing contact tracing with our team, we've seen the situations, and Wafaa highlighted some of these, where COVID spread. So I share these with you, again, as a reminder to stay safe. If you come to campus when you're feeling sick, if you have symptoms, or if you've had a known exposure, you're putting other people at risk. Your professors would rather you take extra care and stay home than come to class in those situations. Similarly, failing to observe appropriate physical distancing, which is 6 feet apart while eating together, puts you at increased risk. We know we all want to eat together. We want to take off our masks and eat with our friends. But if you do so, keep that 6 foot distance, again, to prevent those exposures. And similarly, so much of our furniture has been set up to maintain that 6 foot distancing. Moving those chairs, workstations, and desks, again, puts people at risk if you come closer together. And again, lack of consistent and appropriate wearing of your face covering is also another reason where we see transmission. We're sharing a lot of information, so I do want to highlight the covid19.columbia.edu website. That website for the last 9 months has been dedicated to all things COVID. So please bookmark that site. Anytime you have a question, go there first. There are so many FAQs. There's real-time data updates. There's even a chat bot where you can post your questions and get answers. So we always get a lot of questions about testing. Our testing approach started last summer, and we've evaluated it continuously. We've adjusted it many times as the situation has evolved and changed. And we get input from epidemiologists and statisticians and modelers and infectious disease and public health specialists to really inform our approach, which is very flexible and adaptable based on the situation, both on campus and around us in New York City. So for those of you returning to campus or here for the first time, there's several adjustments, again, which are very responsive to our changing needs. In order to accommodate all of this, we've created 2 large-scale, high-throughput testing sites, one on the Morningside campus in Lerner Hall, and the other one's at the Medical Center campus in the Black Building. We're using large spaces in both and routinely doing over 2,500 tests a day across our testing sites. So the first big requirement is gateway or re-entry testing. That is required for every single person that's coming to campus this spring term. What is a gateway test? It's the first test you take with us. It's nothing special about it. It's no different. But the very first test you take is the gateway test. And if you did not complete this test before January 25th, you won't have access to campus right now. You'll have an automatic red pass on your app until this gets completed. And doing this test is required regardless of whether or not you were here in the fall and were testing in the fall. So that's the first part of the testing program. The second is ongoing surveillance testing. Our surveillance program has been so important in monitoring our campus prevalence of SARS-CoV-2 and determining what adjustments we need to make in our broader public health protocols. So everyone who's accessing campus regularly is strongly encouraged to participate in weekly testing. For those of you who come less frequently, you can also get weekly testing or travel-related testing as you need to. But the one piece we do, and this is mandatory, is surveillance of 10% of our population per week. This is a random sample of 10% of the population outside of our undergraduates who are accessing campus every week. If you are invited to participate in that, you will get a 2-week window, and it is required. So please do so, because not complying with that will lead to a red pass. If you are participating in the weekly testing and you get that email, don't worry, your weekly testing applies. And for our undergraduates living on campus, they are complying with their twice-weekly testing requirement. The only testing we don't do at our testing sites is symptomatic testing. So if you have symptoms of SARS-CoV-2 infection, please don't come to our testing sites. And that's for the safety of our staff and all the other 2,500 people accessing those sites. We want you to be evaluated by a clinician. So please reach out to your campus student health service for a telehealth visit. And then if you need to be tested, you'll be invited in to the student health, either on the Morningside campus or on Haven Avenue at CUIMC to get tested there. So I quickly just wanted to review the testing logistics. Again, please don't come to the testing site if you have symptoms. But to get a testing appointment, and we are appointment only, we don't accept walk-ins, go to the health portal. It's listed here. It's listed on the COVID-19 website, and schedule a convenient time. For our undergraduates living on campus, this must be on your assigned dorm days. And for others, schedule on the day that is convenient, but again, no walk-ins accepted. You get a 10-minute appointment slot. It doesn't take 10 minutes, but you come within that 10 minutes, and please arrive on time. Our schedule is built to ensure that we do not get crowding. When you come to the testing site, we want it to look empty. We don't want you to wait on lines. We don't want you to be exposed to many people. So that's why we're so strict with the testing time. If you come early, you'll be asked to wait outside. And if you come late, unfortunately, you won't be able to test and you'll be asked to reschedule, again, for the safety of our whole community. When you do come, be sure to have your appointment QR code ready, have completed your app prior to your arrival. And just one quick word, if you do get a red pass on the app because you're in quarantine, that's okay. Coming to our testing site is okay as long as you don't have symptoms, and our staff know that even with that red pass, because you're quarantining, they'll let you in. And again, as I shared, and we even got more reports this morning, most people report from entering to leaving our building with their test is less than 5 minutes. So it's really quick, really easy. And for those of you who've not yet tested, I just wanted to share that it's a very simple test. It's a self-collected lower nasal swab. Literally, you put a little Q-tip into the lower part of your nostrils. You do it yourself under observation. It is not the painful brain tickle that some of you may have had. So contact tracing, what's that? And how are we doing it? So contact tracing allows us to quickly identify, contain, and suppress transmission of SARS-CoV-2. So anyone who's diagnosed with COVID-19 will be interviewed by a member of our contact tracing team and will be asked about the people that they've had close contact with. Close contacts defined by the CDC in New York State. And we figure out who they were in contact with while infectious. And then without revealing the identity of the person who's diagnosed, we then notify the contacts of the potential exposure and ask them to quarantine for 10 days. It's important for me to emphasize that any information we collect is confidential, but participation in contact tracing is required as part of the Columbia Community Health Compact. We did create our own contact tracing team through a partnership between Columbia Health and ICAP at the Mailman School of Public Health. And we've developed a very extensive training curriculum that not only covers the standard elements of contact tracing that are used by New York City and Department of Health, but really to make it very specific and applicable to our population, to the situations on campus. And we only manage tracing of Columbia affiliates, but we have a large team now, 3 supervisors and 19 tracers, and they're highly efficient. They're working 7 days a week so we can rapidly contact trace. So if you test positive through our system, through our testing, we are going to reach out to you automatically. But if you do test positive for COVID-19 using an outside provider, we ask that you let us know at covidtesttrace@columbia.edu or by calling our helpline. This will allow us then to instigate the contact tracing. We do notify your school or department if there is a positive case, but we don't let them know anyone's identity. So we simply say a case of COVID-19 has been found in whichever school. Please note, if you've heard about a case in an area and you don't hear from our contact tracing team, that means you were not a close contact and you don't need to quarantine. So just what makes you a close contact? So when someone is tested positive for COVID-19, a close contact is defined as someone with whom they were within 6 feet for over 10 minutes in a single instance, or within 6 feet for a cumulative time of 15 minutes or more in a 24-hour period. If you fall into that category, you'll be notified and given instructions on quarantine for 10 days and testing. And again, if you don't hear from us, you don't need to quarantine. So quickly, just what's the difference between quarantine and isolation? Because this comes up really often. So isolation is when we separate the person who's diagnosed with COVID-19. So they have a positive test or symptoms, and we separate them from the rest of the population. That person is required to isolate for at least 10 days and also to not have any fever for 24 hours and start to feel better. Quarantine is actually different. It's the separation of a healthy person from the rest of the population because they've been exposed to see if they become sick. And we're using quarantine for 2 reasons right now. First, it's what I just described, someone who's a close contact of a person diagnosed with COVID-19. And these people have to quarantine for 10 days. We do recommend they get tested at day 5 to 7, because that's kind of the prime time that if they are going to test positive, they may. But even with a negative test, the quarantine still lasts for 10 days. And the second reason for quarantine is after travel. New York State has travel requirements that some of you may have already had to go through, which include testing before, 72 hours before coming to New York, then quarantining for 4 days, then testing on day 4 to exit quarantine. And if you're unable to be tested 72 hours before leaving your destination, the quarantine is 10 full days upon return to New York. If you have previously tested positive, you're still required to quarantine in New York for the first 4 days after your arrival, but not to repeat the testing. And again, for those of you who tested positive in the last 90 days, make sure your positive results are uploaded so we're aware, and you are exempt from testing for that 90-day period because you can continue to test positive up to 90 days, even when you're completely recovered and not transmitting any virus. I just shared this around the New York State guidance. Apologies for not advancing the slide. Okay. So a few final slides. Wafaa covered many around vaccine. And again, I just want to enhance the big question that we're going to get, when are we going to get vaccine? And as you're all aware, supply is very limited. It's being distributed to the states, and then the states are distributing it. Columbia University does not have a vaccine allocation. No universities currently do. Right now, the allocations are to hospitals and other sites, and we have to follow the CDC prioritization. So the only folks getting vaccinated right now are those in category 1A, which is healthcare workers, and some of those in category 1B, which includes those over 65 and some essential workers. Please be assured that we have a plan. And when the supply chain improves and we get an allocation, we will offer the COVID-19 vaccine to our population. Those of you who've been through our flu fairs know that we have a process in place to be able to do mass vaccination. But as Wafaa said, regardless, even when vaccinated, the same measures stay in place for now. Please check the website. We're constantly updating that, especially as we get more information around the vaccine. We do have a monitoring plan. We're constantly reviewing every element of our campus activities to ensure the safety of our campuses and the surrounding communities. So look out for that. You'll see the range of metrics that we use and the consideration of what's happening both on and off campus around infection rates, cases, hospitalizations, and that will help indicate how we make changes to our public health practices on campus. And I did finally just want to remind you that we have extensive resources for our community on both our campuses for our students. Please remember student health services on the Morningside campus through Columbia Health, or our medical, counseling, disability services, sexual violence response, Alice Health Promotion, insurance and immunization compliance, and at Student Health on Haven with their medical services, counseling services, and student wellness offerings. Many of these services are available in person, and these services are also available virtually. So please check out, there's numerous offerings available to support you wherever you are. Check out the websites to get more information. So I hope you've gotten an indication of the extent of what is going on. I'm really wishing you all the best for this semester and look forward to responding to questions.
Great. Thank you so much, Melanie. And thank you for giving all the incredible work that's happening on the Columbia campus, and also helping in our transition as we really think about what's happening in the pandemic in a holistic health perspective. And student mental health is critical in that respect. And so I would like to now turn to Dr. Holder to provide her perspective around student well-being.
Thank you, Joseph. And again, I appreciate the opportunity to be part of this forum. You know, it's really hard to believe that it's been a year since we've been into this global pandemic, which has impacted virtually every aspect of our lives. We know that this pandemic has resulted in tragic circumstances as we now surpass a death toll in the US of 400,000 and 2 million globally. And I want to acknowledge that you are not alone if you're experiencing a range of emotions due to the significant stress associated with COVID-19. You know, there's fear and isolation and a sense of loss, and our academic life has been really disrupted. And while there is light at the end of the tunnel with the rollout of the COVID-19 vaccine, this virus will continue to affect our lives in profound ways. And so, which makes self-care and wellness, and particularly resiliency, very, very essential. So today I want to focus on strategies for promoting resiliency, but really take a step back and say, what is resiliency? Resiliency can be defined as one's ability to adapt to stressful situations or crises. It's important to know that resilience is not something you either have or you don't. It's not an all or nothing concept. It really does include a variety of thoughts and feelings and behaviors that can be learned and practiced and improved upon by anyone to help in mitigating the impact of stress and challenges. Being resilient does not mean that a person does not experience difficulty or distress. And resiliency doesn't mean that we're meant to sort of tough it out or rely only on ourselves when we're dealing with adversity. Resiliency really does involve reaching out to others and seeking support. Resiliency helps us to build constructive habits and skills in order to cope and problem solve in the face of adversity. So what are some helpful strategies for building resiliency? One that's really foundational is maintaining a daily routine. Get dressed as though you have plans to meet people outside. You know, habits like getting dressed, making our beds just reminds us that there's life happening, even despite the interruptions that we are facing. Consider healthy activities that help to relax you, like listening to music or reading a book. One suggestion I often offer is to create a playlist of songs that offer some inspiration and hope. It's important to maintain a consistent sleep schedule, make time for exercise, and have a regular eating schedule as well. Also consider limiting news and social media consumption about COVID-19. We can find a balance between staying informed with news about COVID, as well as limiting our consumption of distressing news, which we know can intensify our worry. But overall, allow for creativity and flexibility in your daily routine as you figure out, what is working or what may not be as helpful. Connecting with our community is so important, particularly during times of crisis like what we're experiencing with COVID-19. Connecting with people who demonstrate empathy and understanding can remind us that we're not alone in the midst of these difficulties. And despite the constraints of how we must socialize due to COVID-19, social distancing does not have to mean social isolation. And so we want to use the virtual platforms and be creative in how we stay connected to people in our lives. I've heard of virtual book club meetings or knitting club meetings, or maybe a study group. Maybe start a walking group with fellow classmates or friends where you can exercise and connect socially while wearing a mask and still socially distancing. What's key is that whatever you decide, make sure you establish consistent times to connect with others, because it gives you something to look forward to, and it does represent something you can control during this time of such uncertainty. Another element of resiliency related to connecting with our communities is the degree to which you are able to ask and accept help from others. We may have received different messages about what it means to ask for help. Some may think that this is a sign of weakness to ask for help, but in fact, asking for and accepting help are really signs of strength. I want to acknowledge that COVID-19 has created for some of us more challenges in social interactions. Some may be experiencing more conflicts with friends or roommates in managing boundaries and the risk tolerance related to COVID-19, and may have some difficulty talking about them. So I wanted to share some tips that I've been providing to students. And one is to be first clear about the issue. What specifically is the behavior that is causing the problem? Consider what impact that same behavior is having on you. How does that particular problem make you feel? And then reflect on how might the other person see the situation. The other piece that's important is to know your objective before having what potentially might be a difficult conversation. In other words, what do you want to accomplish with this conversation? What might be some desired outcomes? What are some of your non-negotiables? Also, separate the person from the problem. View the problem as a specific behavior or set of circumstances rather than attributing negative feelings to the whole person. I would also suggest being honest with yourself about how hard the conversation might be, but at the same time, manage that with the tension of it also is an opportunity to have a constructive conversation, right? So that there's a constructive perspective that we can hold and focus on what you might be able to gain from the conversation. Maybe there's a better understanding of the situation, or it can also help to enhance the relationship. During the conversation, it is important to communicate openly with your roommate and or friend about establishing some basic health guidelines that address reducing the risk of contracting COVID, and also reviewing roles and responsibilities regarding household tasks that may address issues related to COVID. And it's also helpful to collaborate with your friend and or roommate to create a plan for managing risks related to COVID that addresses each person's concerns, and have consistent times when you're actually reviewing that plan to make sure that each person is being held in terms of accountability. Another strategy for promoting resiliency is accepting that change happens. It is important to note that change and transitions are part of life. Accepting circumstances that cannot be changed can help us focus on the circumstances that we can alter. It's important to determine what level of control we have over a situation, because we can spend too much time on the things we have little or no control. So evaluate your level of control of a situation by asking yourself, where is change possible, and what actions you can take and or what support you can enlist from others to facilitate that change. And this can really help us to not feel so stuck in difficult situations. Learning from your past is another key strategy for resiliency. Identify ways in which you have been resilient and effectively faced adversity in the past. consider what attributes or actions that were helpful in really making a positive difference in guiding you through those past challenges. And by focusing on our strengths, our assets, and our abilities, we can feel more empowered and prepared to meet uncertainty and the challenges that lie ahead. The practice of self-compassion, which is one of my favorites in terms of resiliency, is also very helpful during times of transition and challenge. But frankly speaking, it's a practice that we can benefit from regardless of what is happening in our lives. With self-compassion, we give ourselves the same kindness and care that we would give to a good friend, a close friend. Now, there are three principles of self-compassion. There's self-kindness, common humanity, and mindfulness. Self-kindness involves being warm and comforting and understanding towards ourselves when we suffer instead of being self-critical. And yes, we can be disappointed when we experience adversity, like we're not necessarily doing cartwheels or being so excited when we encounter disappointment, like I'm so happy I didn't get that internship I really wanted. It's understandable that we will feel disappointed, but the key here is that we respond to our suffering with warmth and empathy, like, I understand that this time is difficult. We can offer soothing and comfort to ourselves when dealing with pain. So saying something to ourselves like, I'm really sorry. I'm so sorry you're going through this difficulty. Self-compassion allows us to experience our feelings without judgment, and we can intervene and determine what comfort we need in the moment. Now, self-kindness does not mean that we don't acknowledge our challenges and address them as necessary. We can still hold ourselves accountable for our areas of development without being judgmental. The second element of self-compassion is common humanity. It involves recognizing that all humans are flawed, that everyone fails, everyone makes mistakes, and everyone experiences hardships in life. It is recognizing that the human experience is not perfect, and we're not alone in experiencing adversity and suffering. And when we engage in self-criticism, it further isolates us and leaves us alone in our suffering. The last element of self-compassion is mindfulness. And mindfulness can be defined as one's awareness in the present moment. And during times of difficulties, it involves turning towards our painful thoughts and emotions and seeing them as they are, without suppression or avoidance. You can't ignore or deny your pain and feel compassion for it at the same time. And so when life goes awry, there can be that tendency to jump right into that problem-solving mode immediately without even knowing we're in pain or recognizing the need to comfort ourselves for the difficulties we're experiencing. So it's important to pause and recognize how hard it is in the moment. And mindfulness also prevents us from becoming consumed by negative thoughts or feelings. And so when we ruminate about our suffering, it can exaggerate our experience. And so when we experience disappointments, we don't have to then draw conclusions that life is disappointing as a whole. My final suggestion for managing in times of crisis is the practice of gratitude. This is also a very powerful tool. It can be difficult to feel grateful when we're experiencing adversity. Being grateful can represent a choice, an attitude that prevails with both triumphs and challenges in our lives. When adversity happens, gratitude provides a perspective from which we can view life in its entirety and not be overwhelmed by what may be temporary circumstances. Being grateful does not mean we deny the hurt or pain of the situation. Being grateful can help us think about how we can transform an obstacle into a greater good for ourselves or others. So for example, consider keeping a journal where you remind yourself of positive things, things that bring you pleasure, things that you enjoy, personal attributes, things you might like about yourself, and the valued people in your life as well. Also think about sharing your gratitude with others. And we know that this can really help in strengthening relationships. So the next time your partner or friend or classmate does something that you appreciate, be sure to let them know. As always, it's important to seek professional help and support if the distress you're experiencing is really getting in the way of your daily functioning. But But also please know that you don't have to be in crisis. I often say this, you don't have to be in crisis to seek professional support. And so you may contact Counseling and Psychological Services for the Morningside campus and Mental Health Services for CUIMC for assistance. We're a confidential resource offering individual counseling, virtual group spaces, and medication management. So I encourage you to visit CPS and MHS websites to find additional tools that can help support your wellness overall and identify additional tools for enhancing resiliency. So I thank you very much, and I wish you all the best in the spring semester.
Thank you so much, Aisha. And I shared with you another time, every time you speak, I think of another tool that I can use for my own well-being. And so thank you for sharing your expertise with us, because we're all managing this and we all have our good days and our bad days. And so it's important to have a toolkit of resources. So thank you so much. I'm going to speak for just a few minutes in relation to some other updates from a campus perspective, and in relation to some policies and procedures. And I always like to start with sharing my gratitude because, as Dr. Bernitz shared with you, our rates are lower than the general rates, and that's really because of your behavior. It's because of what you're doing in order to keep each other safe and support each other. It's about caring for each other and empathizing with each other. So my deepest gratitude to all of you and everything you're doing. Much of this was talked about, so I won't spend a lot of time, but this is your student checklist for requirements to access campus, your testing, get training, and the COVID-19 training that you do. It's a one and done. So if you did it in the fall, you're fine for the spring. Sign the compact, and particularly not just sign it, but live the compact is an expectation for all students, no matter where you are, particularly wearing the face covering, physical distancing, washing hands. You've heard that throughout this forum. Complete your Reopen Attestation app, and please get your flu vaccine, which is required to access campus. I also wanted to highlight the events policy. And so as a reminder, Wafaa alluded to this regarding small gatherings need to be happening, because what we're seeing is when people congregate, then that is what is causing spread. Our events policy is 10 people or fewer. It's for both on and off campus. It's for organized events by student organizations, as well as personal events as you as a person and a student. So please adhere to that. And really the best practice is to be outdoors. And if you can't be outdoors and gather together and choose to gather together, to have well ventilated spaces in order to do that. Also, which was also provided by our experts, is travel becomes a problem, particularly given where we are in this moment. That map, Wafaa, that you shared really resonated with me of the US. And so currently all Columbia-related student travel, that's domestic and international, is suspended. And any personal travel, we ask that it be postponed at this point in time, unless it's for emergencies of a personal nature or family emergencies. Of course, you would want to be there with your families in that particular space. And this will be for a while. And I know spring break is coming up. And so, so just anticipate a wonderful spring break here with your friends virtually. And so continue to please uphold the travel restrictions. A lot of people ask, what can I do? What can I do? There's been a lot of steps here, but the first and foremost is to feel comfortable to go up and engage empathetically with someone who isn't wearing a face covering or physically distanced on our campus community, and just ask them to. And we know this is not always easy. It's not always easy for me, particularly at the beginning, but I have to say, with practice, it has become easier. And, we have created a tips, but just practice it in your head even for the time that it comes. And I have found, even with my friends, to talk, say, hey, I'm a little uncomfortable with you bringing down your mask. Do you mind putting that up for me, please? They usually do it. And so, and if you need help or assistance in, going up and chatting with someone, grab a friend, a classmate, a professor to do it with you. There will be times that students, your fellow friends, may choose not to uphold the compact after you stepped in. And so you can always file a report with us through student conduct. And the report is an online report. It's pretty simple. It's on the University Life website. And please give as much detail as possible. So that allows us to follow up in that space. Once you follow a report, what happens? So we take an educational approach and a progressive discipline approach on our campus through student conduct and community standards. So for low-level violations, particularly first-time violations, so low-level being not wearing a face covering appropriately or physically distancing, that begins with education. If there's repeated violations, or if it's a higher level violation, like having a party, that goes to a dean's discipline process, which is a review in which all parties will have an opportunity to dialogue about that and share their perspectives in what happened. If a student is found in violation through the dean's discipline process, sanctions can range from a disciplinary warning to restrictions from campus to including restrictions from housing. So it can be quite serious. Most of what I've seen in the fall has all been done through education and some limited restriction to campus due to concern of health and well-being and quarantine. Student organizations get referred to the appropriate school and their governing body for their particular review and their process. We want you to continue to keep up the great work. There's a variety of ways of doing that. Attend forums like this. Thank you for being here. Read our weekly emails that provide important information and reminders, including how to get engaged. Follow us on social media. Share your stories. And I'd like to share a quick story right here of one of your fellow students.
If I could tell other Columbia students about the need to work together, I will tell them to take this seriously. The effects of the way we interact on campus doesn't just stay within the walls of campus. Like, the virus has a chain effect. So it goes beyond our walls. It goes beyond our friend groups. It goes beyond people we interact with. My name is Achuko Okor. I am a graduate student at the Graduate School of Architecture, Planning and Preservation, and I am keeping our community healthy.
Thank you so much, Ojuko. And you can also create an informational interview, a testimonial, a blog post. Just email us at universitylife@columbia.edu and we'll get you connected. And share your story, share why it's important to you. Talk about what you're doing socially in the time of a pandemic. Talk about your healthy tips, similar to what Aisha did. So please reach out to us. And the other way to get involved is becoming a Keeping Our Community Healthy ambassador. It is a student-led organization. They're focused on marketing, outreach, peer education, and really supporting you and understanding what you can do as a fellow student in order to continue to keep our community healthy. Again, you can email us at universitylife@columbia.edu and we can get you connected there. I did want to provide another quick update around student well-being. Dodge, you may have heard, is now open to undergraduates. The reason it's only undergraduates at this time is because there's limited capacity. It's 33%. This will continue to be evaluated and looked at as things continue to change in the city, as well as looking at the capacity of Dodge as we do this phased approach. It just opened, I believe, yesterday. There's much more information on their website. And then the next phase will be graduate students. There are free virtual classes still available and a lot of programming happening in that space for all students. So please check out the website on here now, or just type in Dodge and virtual classes and you can find all of that available to you as well. University Life continues to provide virtual events and activities. These are just a few that are coming up this spring. So we welcome you to join the fun, meet new friends, and get engaged in those spaces. If you have ideas for future events and activities you'd like to see, then also please email us at universitylife@columbia.edu. And then if you're an international student, particularly living abroad, the Global Centers is partnering across the university with university leadership in order to provide a new initiative that really supports students that are very far from Columbia, at least physically, and because you're not that far from our hearts and collectively and virtually. And so we currently have 9 Global Centers that are open. They're providing study and community spaces. You still have to follow the compact and all the stuff that we've talked about safety and security. And we also have 9 pop-up locations, 7 of which are in WeWork spaces and 2 through partnerships. They're all listed here. And in addition to that, in certain locations internationally, there are about 80 other cities that we have opportunities for students to have access to WeWork facilities, if that's supportive of you and your academics. So all you have to do is go to the CGC website and register there for more information. And so again, I just want to thank you for your partnership. This quote is from a student ambassador. And I think it really resonates with me because it talks about how much you are doing in upholding the compact and keeping our community healthy. And it also acknowledges it's not easy. And we know it's not easy. And that's why we have forums like this, experts that we have here, and to support you. And with that said, I'd like to open it up for questions with our panelists. And so if the panelists can show yourselves and put your cameras on, that would be great. And I know we've already gotten a few questions. So, and I know some of this has been answered in the chat, in the Q&A, but there was a clumping of questions regarding vaccines. Not a big surprise regarding that. I'm going to ask several that were presented during this presentation and prior through the registration. And so, is there a sense when students will be able to get vaccinated? Will there be a strategy around high-risk students getting it first? What is the vaccine plan for students who are, going to labs regularly and needing to be on campus? And what steps would you take and recommend? Should Columbia get vaccines? And if students aren't in New York City?
I can start, and then maybe Melanie can add as well. I think it's important to keep in mind, as Melanie said, is that Columbia does not have access to vaccine supply as of yet, and neither does any other university. So we are constrained and need to follow, of course, the pace of the vaccination distribution that has been put in place at New York State and New York City. So all the vaccines are going now to health facilities like NYP, New York Presbyterian, as one example. And also, it's really absolutely critically important to follow the eligibility criteria that the state has put in place. And for now, that does not include students, with the exception of if a student is engaged, for example, as a TA and is engaged in in-person class instruction, okay? And of course, if they're a student that happens to be 65 years or older, unlikely, but they would be eligible as well. So we have to really stick to these eligibility criteria. Now, in terms of what's going to happen in the future, we're hopeful that with more supply, and there's a good movement now towards more production of vaccine, more distribution by the federal government of vaccine, is this would allow Columbia to get its own supply of vaccines, as well as to expand the eligibility of individuals. So for now, with individuals with comorbidities are not yet on the eligibility, are not eligible as of yet. If they become eligible, then an individual of any age who has comorbid conditions could potentially get the vaccine through that eligibility. So we're awaiting and advocating and working very hard to seek a supply of vaccines, but we also are quite cognizant of the supply issue, and there's so much high demand, and the supply doesn't match the demand. So it's going to be weeks, if not months, before we actually have our own supply and can meet the needs of particularly of the Columbia community, including students. Melanie?
Yeah, thank you, Wafaa. That was very, very thorough. Just 2 quick things to add. The first, to add on to what Wafaa said, is when we get a supply, we're ready. So the planning has happened. The workflow is in place. The required technical documentation is in place. The feeds to the city are all in place. So we're ready when we get a supply. But we are required to follow the eligibility criteria set out by New York State. So if you are in another state and you fall into eligibility criteria within that state, we suggest you get your vaccine there and complete the course, get your 2 doses there. it's very hard to get one dose in one state and then come here and complete that course. So that's really important to know that if you are eligible, go ahead and get it elsewhere. And in terms of the prioritization, though, Joseph, you asked a question around that. Similarly, we've done that work. We know, because students complete your health history forms, we know who our higher risk students are. And if it comes with that needing to prioritize within those criteria, we'll have that ready to go. So as soon as the supply chain opens up, we're hopeful. But as Wafaa said, it's going to take, unfortunately, a little more time than we would have hoped.
Great. Thank you both. There's a question regarding why is the university opening the Dodge Gym and continuing with in-person hybrid courses when student case numbers are continuing on the rise? Melanie, do you want to start there?
Sure, I can start. So we because we've been doing this for some time, we've actually got a lot of information about where students are safe and where they're not safe. And the most reassuring data I can give you is we have had no classroom transmission. Our classrooms are safe because we have procedures in place around physical distancing and use of masks and face coverings within the classroom. We've had no transmission. Similarly, in Dodge Gym, it's a supervised area with very, very strict, well thought out protocols around capacity, which is severely reduced. So again, very, very safe. Where transmission is happening and where rates are going up is around social environments. I think we've all kind of mentioned this and we'll keep mentioning it. That's where people are letting their guard down, taking off their face coverings, sitting close together, hanging out with a lot of people, and that's where transmissions are happening. So those two environments that you mentioned are actually what we consider very, very safe from a public health perspective. Wafaa?
And just to add to what Melanie just said is that, yes, there are larger numbers of students who are positive, but keep in mind, again, this is gateway testing, and we anticipated that this would be the case because people are coming from every part of the country and the world and are getting tested at this point in time, at this moment in time. We are hopeful that through the follow-on testing, we hope that through the follow-on testing that will be the required by twice a week testing for undergraduates, the strongly recommended weekly testing for others, that we're hopeful that the positivity rates will remain low as we stabilize the population that's here, that has access to campus.
Thank you both. Aisha, this question is for you. A student asked, what causes a stable mind and secure mental health?
Mm-hmm. So I think it's a question that needs to be responded to in a very holistic way. There's so many facets to supporting mental health. So if we begin with physical factors, and that's why it's so important to make sure that you're maintaining a daily routine, you're making sure that you're maintaining consistent sleep schedule, you're eating regularly, making sure that you have healthy nutrition, getting exercise. So there's the physical component, and there are also psychological components, right? So thinking about what are the tools in your toolkit for managing stress, and what might be some coping tools that you have, focusing on issues around resiliency, challenging thoughts around perfectionism, right? So that helps to manage our mental health. And then community, the social components. And I know that's where COVID-19 has really caused a lot of disruptions, where we're really separated from our communities in the ways that we would normally be interacting with them. And so social connection, sense of belonging. We know that loneliness is connected to physical health as well as mental health. And when that is pretty pronounced, we know that our mental health can be compromised. And then also looking at mental health from a macro standpoint, right? So when we think about issues of racism and sexism and other forms of oppression, that can also have an impact on our mental health. And so that's why when we think about wellness and mental health, we have to look at it from so many different avenues and identify tools and strategies for supporting each of those areas that make up our mental health.
Great, thank you. So I'll clump a couple of questions. So one is around, what do you say when people ask when or whether we will return to normal? Particularly around physical distancing and face covering. And then the second one, I'll paraphrase to kind of capture a couple questions is, how will all of this change the way the university works when we come back together in person? How do you see COVID changing us in the longer term?
Want me to start, Wafaa, with that one? Wow. That's the all important question. When will we get back to normal? We need to beat the virus, and it's a little ways away, right? We need to have a large percentage of the population vaccinated so that the virus isn't winning. And I think that's a ways away. Is it late summer? Is it the fall? Is it beginning of 2022? I think it's a little too early to tell right now. But hope is there, right? And I think that's the important thing. It's the end is in sight, but we're not there yet. And that's why it's just all the more important to remember the stuff we're doing right now, right? We don't want to let our guard down when the end is really in sight, but we're not quite there. I'm sure we've all got different opinions on how the university is going to change. I think there's so much that we've learned that actually helps us in the long run. I'll speak for Columbia Health. What we've learned about telehealth and access to care through different methods than what we were used to before. Aisha will know, because of the work CPS done, we're able to offer support spaces to a wider range of people on a wider range of topics. We don't have to worry about booking space anymore. We can, cut across time zones. So I think there's a lot of things that we'll rethink around the way we do, each of us, the way we do our work. We're going to say, okay, what was the actual good that came out of COVID-19, and allow us to maybe change the way we look at our work. But I'll turn over to others who probably have opinions.
Yeah, I mean, I can add a few things. I do think, I think COVID-19 will change this whole generation. I actually think so. I think, there's a silver lining to this pandemic, or I'm the kind of person who's very optimistic and find the silver lining. And Melanie mentioned some of these. I think actually I feel that because of this terrible physical separation that we've had to endure, and the inability to connect with loved ones and colleagues and family and loved ones and colleagues, is that I think I'm hopeful that we will actually value these relationships even more because of having lived through this very difficult time, and will value the interactions with people more deeply. I know, for example, I'm here in my office, and we are very low density, but when we get together, 5 people in a large conference room, it's very special because we're together. And I also think some of even the behaviors, like what's been noted is there less in other infectious disease, less colds and so on. So it is distancing and more hand washing. So some of the even behaviors that we've adopted may endure with us as well. And I think also I feel like people are, have maybe a certain kindness that hopefully will permeate society in terms of, again, respecting each other and being kind to people who have less, and older people who have to be at home and so on. So I think this will change all of us, and it will change Columbia, and will change everybody at Columbia. Aisha?
No, I would say very much agree with the sentiments that have been shared. I think that my hope with the pandemic is that it will bring forth the importance of social connection and really address, I think, an epidemic that was present before COVID, which is around loneliness. I remember the former Surgeon General talked about epidemic in the United States being loneliness. And my hope is that people can prioritize their relationships more and see them as an integral part of their lives, and hopefully feel more of a sense of belonging, and be able to think about, well, what does meaningful connection actually mean? How do I determine what feels like a quality relationship? I think sometimes there can be a focus on quantity, like how many, Instagram friends do I have, or how many times have I texted a friend? And I'm not, dismissing that, but it may not represent quality for all of us. So we have to think about, like, what is meaning? What do we associate with meaning in our social connections, and how they're so important that it's not a nice to do or an optional exercise, but it really is so important for our physical and mental health.
Thank you so much. And I think that was a great way to kind of end our panel. And so I'd like to really give gratitude to our panelists and to the entire audience for taking this important time to come together and share valuable information, ask thoughtful questions, and really balance what we know about COVID-19 at this moment in time with what we don't, the uncertainty, and continue to navigate that together, because we know that that's not easy. At University Life, I want you to know that we remain committed to these conversations and to ensuring that as members of the community, you have access to the best and most actionable information possible. And we'll continue to do that with events like this and with our email communications and social media. I'd like to thank our panelists for your time and your thoughts, for having your expertise on this panel, and your perspective is invaluable. And if I may, your leadership on this campus and what you have done for this community through each of your lenses is extraordinary work. And so I know it has been tireless, and I know how much heart and thought and care you have put into this. And I just want to give gratitude for all of your leadership and everything you're doing for our community to keep our community healthy. As a reminder, we'd love to hear from all of you, at University Life. So feel free to email us at universitylife@columbia.edu. Share your thoughts, your feedback, your concerns. If you have ideas of ways that we should be doing things differently, whether it be about COVID-19 or other student life and student engagement opportunities, please let us know. You can also follow us on Instagram and Facebook. You can also always go to our website and look at all kinds of wonderful events and activities and resources available to you. Finally, a video version of this event will be posted on the website in the coming days. So please check back. If you have a friend that asked you about it and you think this was helpful, please share that with your friends so that they can watch at their leisure. Again, thank you for everything you're doing. I wish you a wonderful and healthy evening. Take care.